This paper was published in the Journal of Arrhythmia in 2020, investigating is there a link between vitamin D deficiency and vasovagal syncope or fainting. And so what the authors did was they took 75 consecutive patients who complained of fainting, and they took them through a tilt table test. And if you've ever heard of the diagnosis POTS, postural orthostatic tachycardia syndrome, they diagnose POTS with a tilt table test, or that's part of the diagnosis. And POTS patients experience dizziness and potentially fainting when going from seated to standing. So that's and that when they go sit to stand, they also notice heart racing, and that's the tachycardia part of the name. Whereas vasovagal syncope, they may go from seated to standing and feel dizzy and faint, but they don't have the heart racing and the other parts of the POTS syndrome. So these patients were just vasovagal syncope, which is related to autonomic nervous system dysfunction. Okay, and the autonomic nervous system, remember, is the part of the nervous system that is running things behind the scenes. It's running your heart rate and your respiratory rate and your blood pressure, all the things you're not thinking about, right? So you could think about it as the iOS on your iPhone. This is the iOS of your nervous system. It's running the behind the scenes stuff, all the programs that you're not consciously aware of. And so vasovagal syncope, you can hear in the name vagal, right? Vagus nerve. And we've talked about the vagus nerve a lot in many different videos in our times here. And then I've got other videos that I've made on the vagus nerve as well. And so if the vagus nerve is involved, the autonomic nervous system is involved, and that is the parasympathetic nervous system, which is the vagus side, the kind of rest and digest side, and then the sympathetic nervous system, which is the fight or flight side. So you can see here in this paper, the authors say vasovagal syncope is often associated with emotional stress, pain, fear, prolonged standing, and crowded environments. And so if crowded environments set it off, there's going to probably be some anxiety with that as well. The etiology of vasovagal syncope is based on interactions involving the autonomic nervous system, which causes the predominance of parasympathetic nervous system and consequently development of bradycardia, which is slow heart rate, and hypotension, which is low blood pressure. So if your heart rate slows down and your blood pressure drops, you're going to be worse at delivering blood to the brain, and the brain needs blood because that delivers oxygen and glucose and other things the brain needs. And so if you don't get blood to the brain, you're going to pass out and faint. And so this is how vasovagal syncope occurs. And so these authors again wanted to see, is there a nutritional component to vasovagal syncope? So they investigated vitamin D levels and vitamin B12 levels in 75 consecutive patients with this issue. And they found that the average vitamin D and the average B12 levels were lower in the fainting patients than in the control group. But once they went more in depth with the statistics, only vitamin D was associated with the fainting risk. And so they conclude by saying vitamin D and B12 levels are reasonably low in fainting patients, but especially low vitamin D levels are associated with the vasovagal syncope diagnosed by the tilt table. So fainting diagnosed by tilt table, low vitamin Ds are associated with that. So if you're someone who notices that they're dizzy and maybe nauseous and lightheaded when they go from sit to stand, but you don't get an increase in heart rate, if you tend to have, say, a lower side heart rate and maybe lower blood pressure, then you're probably more the vasovagal syncope type patient than the POTS patient. And, if you've seen doctors and no one's been able to figure out why you're fainting, perhaps you should have them run a vitamin D and B12 levels and If those are low, then repleting those levels may take care of your fainting spells. And that'd be a very inexpensive and safe and beneficial in many other ways to treat your issue. And before we wrap this up, I was interested in the actual vitamin D levels that they looked at in this paper. So if we go here, you can see in this table, they're comparing healthy people up here to syncope patients, okay? And if you look at the vitamin D, you know, they said that the syncope patients had lower than the healthy people, and they do, and it did make a difference. But you know, the astute viewers who have been around for a while, especially with the vitamin D videos, will realize what all of these, every single one of these people in the study, the 75 fainting patients and the 52 healthy patients, all of them were lab low in vitamin D, all of them. So if you go look at your LabCorp reference range for vitamin D, it's 30 to 100 nanograms per milliliter. And if you look at this table in the study, the quote unquote healthy people had 24 and a half plus or minus 6. So they were between 18 and 30 is the cutoff for lab low, whereas the fainting patients were between 12 and 28. And so nobody in the study was even in normal range of vitamin D. So the likelihood is that all these people, quote unquote healthy and fainting patients, all would benefit in some way by raising their vitamin D levels. So again, it's another example of the research just woefully inadequate in terms of what they consider healthy and unhealthy levels of vitamin D. Every 100% of the people in the study fell below the normal range. And then look at the B12, same idea. The quote unquote healthy people ranged from 236 to 636. The fainting patients ranged from, say, 263 to 463. Okay, from a functional medicine perspective, a vitamin B12 level, a serum B12 level, less than 600 is insufficient. So again, almost all of these people would fall below what would be sufficient B12 status. And so again, the research is looking at one certain variable here. So, you know, and they come from a different paradigm, but I just wanted you guys to see that what they're calling healthy people all entered the study with unhealthy levels of both nutrients that were being tested. And then of course, the ones with symptoms had worse levels.